Hey guys, I'm esthetician Trish McCarty. Today is a different kind of video. We're not talking skincare. We're talking functional rhinoplasty, which is what I had 2 weeks ago. Oh my gosh, can you tell? No, because I had a wonderful surgery experience. Dr. Peter Ray did my functional rhinoplasty. You seriously can't even tell anything happened. Like, it's insane. I can tell something happened because I can breathe. I am so happy I had this done. I know I'm supposed to say that at the end and make you watch for hours, but I'll just cut right to it. I am happy I did this because I was terrified my entire life of this surgery. I just knew it was going to be horrifying pain. I knew I was going to look insane. None of that happened. Well, I did look a little weird, but it overall was so much better than I expected. And I would just encourage you, if you're having trouble breathing, especially, seriously, find a good surgeon or come to Dr. Ray. You know, obviously he did good. You will hear in this video my pre-op appointment. Dr. Ray was so awesome to let me film a video of him discussing his plan for my surgery. He talks about what the CT scan showed going on inside my nose.
In general, the way we try to think about noses and how they work is you have here the central septum and the side walls, and right up on the top in the middle is we call the nasal valve. And so the valve is one part of what allows air to come in and go out. The other thing is the septum, and you can see on Trish, her septum doesn't go straight up and down like this. Her septum goes way off that way and way back this way. And so if the septum is crooked, that can also keep the airflow from going straight back, particularly on this side. But the third thing that affects it is what's called the turbinates. There's these little airfoils on the inside, similar to an old-fashioned radiator. And those humidify air, but they also can get in the way of the air. So the turbinates can be large because of inflammation from allergies, or they can just grow too big, or what can happen is if the septum is pushing on one, the other one can grow, and that's actually what's happened on Trish's side here. This turbinate here has grown relative to the other side, but this other side is pushed down and blocked there too. So if you have the valve, you have the septum, and you have the turbinates, those are three areas that can make difficulty with airflow going through. So traditionally we think about the nose in thirds, the upper thirds being the nasal bones, the middle third being the little cartilages there, and then the bottom third being the other cartilages here. So what we're going to do for Trish, if this is her nose, we're going to come in, we're going to make a small incision right underneath her nose. Probably the only person that can see it is somebody who kneels down and tries to propose to her or something like that, but it's hidden right in there. And then we sneak on the inside, we make an incision up inside the nose, and then we basically take the skin and peel it all the way back, and then we go down and we split here and here to the right and to the left and get down onto the septum. And then we work our way inside, almost on the skull here, you can see. Right there is the crooked part, and those are the turbinates, the little bony parts of the turbinates on either side. So we will take her nose, one side this side, one side that way, take the top up, and we'll go in, and very gently, and so she won't feel a thing, we'll straighten all that out, and then on our way out, put it all back together again, reassemble it. As we say, some assembly required, and afterwards, for a short time, she's not going to like me because she's going to have little splints in here, and here, and she'll be very hard to understand on the phone. But after we take those out, she will breathe, she'll smile, she'll get a little dizzy, sometimes she'll fall out. But anyway, once she recovers from all that, then she will be able to breathe in a way that she hasn't breathed probably in years and years and years. And the other thing that's really interesting is she may be able to smell better because your smelling nerves are way at the roof and no air is getting up there. And because you can smell better, you may actually taste things better. So if any of that happens, we'll take credit. If it doesn't happen, it wasn't meant to be. But that's our plan. Straightforward, simple thing, nothing for Trish to worry about. And she wanted me to explain it to you guys today.
I've worked with Dr. Ray for over 7 years at Marshall Plastic Surgery. I trust him not only as a colleague, as a friend, and obviously as a plastic surgeon. So I am very happy with my results. He said I would probably have a little scar there. Where is it, Dr. Ray? I mean, that little red dot? No, I think that's from me rubbing it a little teeny bit, actually, when I was cleaning it. You'll see in an upcoming video, I'm going to show you like a daily diary of how I looked each day, how I was feeling, what I dealt with. And then I also want how to care for your nose video and little tips and tricks that I found very helpful that I think everyone should know. Would anyone like to see my photos from my actual surgery? Comment down below. I have not looked at them yet. Some of my coworkers have looked at them and they're like, oh my gosh. He said my nose was really bad inside. Thank you guys so much for watching, and make sure you stay tuned for part 2 and 3. And I'm so sorry I have to break this up in different videos. If you want to know the whole story, please just follow, and I'll have a whole playlist dedicated just to the functional rhinoplasty. If you found this helpful, give it a thumbs up. Make sure you share this with a friend who you know who has the deviated septum and they're putting off getting the surgery. That was me for literally like, I'm 36, so I put it off for like 35 years. I mean, I was terrified of this surgery, but I've always wanted it. I've always wondered, what is it like to breathe like a normal person? I did not know until 2 weeks ago what it was like to breathe normal. But the best way I can describe it, if you use like Vicks Vapor Rub, I hear that a lot with people with a deviated septum, myself included. I used to do that a lot, especially when I was younger. And I would like smell eucalyptus just to get that sensation. That is what it's like breathing all the time, people. I had no idea. It's like having eucalyptus all the time. And I didn't know what that was like. So if you're like me and you always had one, just imagine having that permanent eucalyptus feeling. Maybe not quite that. Like, it won't smell as minty though. Anyway, thank you guys so much for watching, and stay tuned.